FIP stands for Feline Infectious Peritonitis. And you already know a little bit about FIP because what FIP is actually feline coronavirus. So as we've just gone through the coronavirus pandemic, the world has become aware of coronavirus. But veterinarians have been focused vigilantly on this virus for decades. The original research and understanding of coronaviruses really laid in the camp of veterinary medicine. FIP is a different version of coronavirus than we see in humans. Very important to say that the human coronavirus doesn't affect cats, and the cat coronavirus doesn't affect people. We call that species specific. But we now know in the human species how devastating a coronavirus can be. In feline medicine, the virus manifests not in the respiratory tract, but it initially manifests in the intestinal tract, but then rapidly, in some cases, spreads to the entire body, and until less than a decade ago, was considered a 100% fatal disease. So the virus, coronavirus, in cats is very contagious as an intestinal virus. But as an intestinal virus, it is relatively harmless, usually asymptomatic. But in about 10% of those cats, that virus changes. We call that a mutation. And when that virus mutates in that 10% of cats that have contacted the gastrointestinal coronavirus, it develops a capability to be deadly. But not all of those progress to the deadly state. About 10% of those, so about 1% of all the cats that have had this exposure, it will progress to a very, very fatal version of the disease. Instead of attacking intestinal cells, that virus will get into a very special part of a cell called a macrophage, and it will spread through the body, and it will create a tremendous inflammation. And when it does, we no longer call that coronavirus. We call that feline infectious peritonitis. And feline infectious peritonitis, until 2016, and really not until 2018 and 2019, did we consider anywhere close to a curable disease. Viruses in general, we do not have real cures for. We can control viruses, but not really cure them. Not like a bacteria where we can give them an antibiotic and we can truly kill the bacteria and cure the disease. But we are making progress both in human and veterinary medicine. A brilliant scientist, Niels Peterson from University of California, Davis, through decades of investigation, finally came upon a cure. The cure is called GS441524. That long number was just because it was a large catalog of molecules that a company, Gilead Sciences, had that they allowed veterinarians to study. Very interesting story about GS441524 because no one really cared about that molecule very much. It was actually originally developed maybe to help what everyone feared would be an Ebola epidemic. But guess what? We were lucky Ebola did not become an epidemic. And so it just kind of stayed on the shelf. But medicines were developed around it that ended up not getting used. So Gilead allowed veterinarians to use this medication. Lo and behold, feline coronavirus suddenly became important because human coronavirus, COVID-19, dramatically was killing human beings. And that GS441524 actually ended up being developed into a drug called remdesivir. So we would not have even known or probably used remdesivir in the coronavirus epidemic and pandemic in human beings had it not been for Niels Peterson and veterinary research on FIP, feline infectious peritonitis. But suddenly this medicine, GS441524, became available if given to cats, which for a lifetime of veterinarians had been considered a fatal disease, and not only fatal, affecting kittens, And sadly, not only affecting kittens, but usually within 8 days of diagnosis, 99 to 100% of those kittens were dead. Suddenly, that diagnosis can be made in that same kitten, who now 10 days later would probably be dead. And magically, a medicine can be started and they go into remission and they are cured. And evolutionary, revolutionary paradigm shift from an untreatable disease, feline infectious peritonitis, to a curable disease.